Good morning. My name is Jamaica, and I'm going to discuss my Doctor of Nursing practice project. I'm going to implement the STEADY Fall Risk Assessment tool into EHR so that we can streamline fall risk assessments. Falls are the leading causes of injury and death among older adults, making them a serious safety concern in healthcare settings. More than 1 in 4 adults aged 65 and older, which is over 14 million people, report falling each year. About 37% of older adults who fall suffer injuries requiring medical treatment or limiting activity for at least one day. That is 9 million injuries annually. Long-term care facilities experience especially high fall rates, which not only harm residents but also lead to significant costs for facilities. Because of this, using evidence-based practice is essential to guide prevention efforts. The CDC's STEADY program offers a standardized approach to identify and reduce fall risk. The CDC provides clear guidelines for how the program should be implemented and integrated into clinical workflows. My project overview. My project focuses on preventing falls in older adults living in long-term care facilities. These are adults 65 years and older. I'm using the CDC's STEADY program, which is an evidence-based tool to identify and reduce fall risks. I want to integrate the STEADY program into the facility's electronic health records so that nurses can complete fall risk screenings, document results, and use decision support to guide care. This approach helps improve patient safety, it reduces injuries and hospitalizations, and supports compliance with CMS requirements. Through this project, I am also demonstrating the role of the DNP prepared nurse in using informatics, leading staff through workflow changes, and driving quality improvement. The informatics technology role. Informatics is the center of my project because it allows the CDC STEADY tool to be integrated into the electronic health record. By embedding the assessment into the EHR, nurses can easily complete fall risk screenings during routine care, and the system can provide real-time decision support. This means the technology doesn't just store information, it also helps care planning by giving alerts, reminders, and documentation tools. Informatics also improves communication between providers by making patient information more accessible and consistent. Using health IT in this way supports compliance with CMS quality measures and connects to the safer guidelines to ensure the technology is safe and effective. Informatics makes it possible for the STEADY tool to be part of our daily workflows, and it improves both patient safety and nurse efficiency. Orum's self-deficit nursing theory relates to this project because many residents in long-term care experience limitations in mobility and independence, which increase their risk for falls. By integrating the STEADY tool into the EHR, nurses can better identify self-care deficits and provide interventions that promote safety and independence. The Iowa model of evidence-based practice connects by providing a structured framework to guide the implementation of the project. It supports identifying falls as a problem, reviewing the best evidence-based information, and piloting the STEADY tool, and evaluating its outcomes to improve care. The AACN DNP Essentials also aligns with this project as they emphasize the role of the DNP prepared nurse in using informatics, demonstrating leadership, and driving quality improvements. By leading the integration of STEADY into the EHR, this project showcases DNP competencies in advancing evidence-based care, ensuring patient safety, and aligning with value-based reimbursement models. Here is a preview of the workflow provided by STEADY. It is the algorithm that's used for fall risk screening assessments and interventions among community dwelling adults 65 years and older. To ensure that each step in the study protocol is consistently followed, a visual workflow and workflow chart is used. All medical personnel participating in the screening, assessment, and intervention and follow-up procedures can use this workflow chart as an easy to understand and well-structured visual guide. And it has steps 1, 2, 3, and then goes down to follow-up. Implementation workflow. All right, so we're going to start with staff education on the study tool. We're going to input the tool into the EHR and customize it specifically for the location for long-term care settings and put it into the EHR system. We're going to pilot testing in long-term care settings, and then we're going to do ongoing monitoring and evaluation to see if it's successful. Regulatory and ethical considerations. HIPAA and high-tech are important because they keep patient information safe and private when the study tool is used in the EHR. The Patient Safety and Quality Improvement Act helps by encouraging staff to report safety concerns and share information that could prevent falls without being punished. CMS requirements also matter because they connect fall prevention and documentation to reimbursement. This means that using the study tool correctly not only protects patients, but it also helps the facility meet rules and get paid for quality of care. Together, these regulations make sure the project is safe, it's ethical, and it supports better patient outcomes. Benefits of implementation. Using the study tool helps staff find fall risk early so that actions can be taken before an injury happens. This reduces the number of falls and injuries and hospital visits. Patients benefit because their safety and quality of life improve. The facility also saves money by preventing falls and meeting compliance standards, which can lead to financial incentives. So this is great for our stakeholders, our nurses, and the workplace. DNP leadership role. Doctorate prepared nurses can lead EHR adoption and workflow redesign. They facilitate staff training and interdisciplinary collaboration. They can apply health IT safety guidelines, ensure sustainability of quality improvement efforts, and DNP-led projects that use EHR tools were also found to improve care quality and increase staff engagement. In conclusion, falls in older adults remain a serious and costly health concern, especially in long-term care settings. Evidence-based programs like the CDC's STEADY initiative offer a structured and effective approach to identifying and reducing fall risks, but successful implementation requires strong leadership, proper workflow design, and support for the health technology. This project shows how DNP prepared nurses lead in using technology to improve patient care. By guiding the integration of the STEADY tool into the EHR, the DNP demonstrates leadership in informatics, helps train and support staff, and ensures patient safety stays a top priority. Thank you all for listening to my PowerPoint and my presentation. Below are the references associated with the information that is on the PowerPoint. Thank you guys so much.